Welcome to the latest episode of MQ's Open Mind. And today, Craig and I are absolutely delighted. We have a fantastic guest, Dr. Sian Williams. And Sian, maybe known to many of us, is a broadcaster of maybe over 35 years and also a psychologist. And it'll be great to hear about your journey today, Sian, from broadcaster to psychologist. But first of all, a huge welcome and a huge thanks for taking part in the podcast today.
Oh, I'm absolutely delighted to be here. And I have to say, Rory, I'd tell you that I've been in one of your lectures and it was inspiring. So I'm just putting all that back to you. It's great to be here. Thank you for asking.
Well, that's very kind. That's very kind indeed. But let's get going, Sian. This is about you, not about me or Craig. So no, I'm really genuinely fascinated. I've been following your career for many years, and I followed the transition into psychology. But can we maybe go right back to the beginning, before your pre-interest in, or before you were interested in mental health? But tell us about your early life and career, and how you got into journalism, first of all.
Oh, gosh. So my parents, one was a nurse and worked in intensive care, and my mother and my father was a journalist. And I thought, while my mum wanted me to work for the NHS, because we're really sort of steeped in that. So we've got a lot of doctors and nurses in our family, and I think it's now 6 generations of my family have worked in healthcare and the NHS, and they were in healthcare before the NHS started. She wanted me to go into the NHS, and I just thought, I can't even watch an episode of Casualty or Holby City without having a little wobble when they get the needles out. So nursing or being a doctor is not going to work for me. My dad was a journalist, and that looked incredibly exciting because the radio was always on, tuned to news. We had all the newspapers. He was being called in the old days when you didn't have mobile phones and you had a phone attached to the wall, or one of the big dial phones. It used to ring, and every time it used to ring, I used to think, we're going to lose him now because there's a job he's going to be going off to. But it did seem really exciting. He didn't want me to become a journalist, and he said, do not become a journalist, and whatever you do, don't join the BBC. And I did.
You clearly listened to that advice.
Exactly. It was the only career really I wanted to do at that time. I liked reading, I liked writing, I was interested in the news. I'd gone to America to study critical journalistic writing. I was very lucky to have won a place in America to study at an American university for a while. And it seemed like a natural choice for me. So I kind of badgered and persisted and got into the BBC, and then spent 37 years, I think it is now. I'm back at the BBC doing radio, and I started at the BBC doing radio all those years ago in the late 80s. And then I guess I got interested in the way our minds work. We were often sent as journalists to very traumatic events. No, that's the stuff of news, isn't it? Disasters, and you're parachuted into what's often the worst day of somebody's life. And I was introduced to that very early. As soon as I came out of university and went to local radio, I reported on the Hillsborough disaster. I was working in Liverpool at the time. And I think became very aware of what it must be like to be caught up in an event not of your choosing, to be exposed to something that will change the rest of your life. And as a very naive 20-something-year-old, 21-year-old, I probably asked all the wrong questions. But I did think to myself, gosh, how are these people going to manage when I leave? I've got their stories, and there's a huge responsibility with carrying those stories. But what happens to their life when we've all gone? When the story starts inevitably, as they always do, dropping down the running order? And how do they manage that experience? How do they live with that experience? And then throughout my career, I was sort of drawn back to that understanding. What goes on in the brain? How can we best support people, either those who are caught up in that event or those witnessing that event, like journalists? How can we best support people to manage that stuff well? And that took me into psychology.
So you're maybe 25 years into your broadcasting career when you sort of actively then started retraining. Is that about right? I think it was about 2012 maybe, or something like that. Then
well, I did a science master's, which was quite theoretically based in psychology at that stage. Previous to that, I had trained as a trauma assessor. So very simply, identifying potential red flags in some of my colleagues who were coming back from difficult assignments. So I'd recognized in myself that there were some times when I would get back from an assignment, I wouldn't be able to talk about it with anyone. I felt quite guilty that I was leaving. And leaving all these people behind, that my help, as it were, was quite limited to showing the audience the horror, but then I could always go back to my family and my comfortable life. And I was aware that other journalists, similarly, who had been immersed in tragedy, or it might be a really difficult court case on child abuse, or it might be at a natural disaster or a terrorist attack, that they'd been immersed in this stuff, to report to the public what had happened. And then when they came away from it, sometimes it was hard to process. So I trained as a trauma assessor many years ago, and then I did a master's while I was still at the BBC, and then I went on to do a professional doctorate in counselling psychology while I was working at Channel 5 as a newsreader.
We'll come back to the doctorate and stuff. I'm just still curious about the trauma account. So was that off your own initiative, or was that a BBC thing that as an organisation they were keen to support journalists better, or was that?
So I knew that there was some support being offered, but was also aware that the culture of journalism often prevented journalists accessing it. So things like employee assistance helplines, things like just reaching out to a peer support network, or those things existed, but they didn't seem to be accessed very often. And I wondered why. But when I could see my own colleagues were having some difficulty, and there was something being offered at the time called trauma risk in management, which was designed, you probably heard about it, by Professor Neil Greenberg, who was in the Marines, and a psychiatrist, works at King's. And I contacted him and said, "Are you running this at the BBC?" And he said, "We're just starting to do a few training courses." And I went on that training course and learnt what to look for, not to ask questions that will go deep into any trauma, not to reactivate any trauma, not to make anything too emotional, but just to ask enough factual questions so that if somebody was struggling with sleep, or they weren't communicating with their family, or they were having other kinds of difficulty, that you would just go, "Oh, okay, I'm going to come back to you in a few months' time, and then back to you again," and make sure that I'm directing you to the pathways for help. So yeah, that was where it started, 2005, I think, 2006 maybe.
Yeah, but you seem to have been really psychologically minded from such early days, even before that in your career. So the thinking of the impact on yourself and the viewer and your colleagues.
Well,
these difficult and challenging situations.
Yeah, and I wonder whether that actually came from my mum's side of the family, because she was a nurse, and because she was a very caring woman, and she cared for her patients psychologically as well as physically. And I could see that work could take a toll on her when she lost patients, and she could be very low after working with people that she couldn't help. And I think that brought an awareness of the impact that a caring profession can have on you, and any job can have on you when you are immersed or exposed to other people's grief or illness or trauma. And so perhaps I was more alert to that when I became a journalist and saw it from a different perspective. And thinking, what goes on in the mind of those experiencing traumatic events? How can we best protect them if we are given responsibility for their stories? And how can we best protect ourselves when we're witnessing those stories so that we continue to tell them well?
I suppose what you just said there just reminds me of, I suppose, what you do in the Radio 4 program now, the life-changing program, in a way. That's why it's just what you said about people telling their stories, or, well, in a way which is acknowledging, well, there's some amazing stories of people's lives that you cover in that. And I'm also thinking you did, and then at Channel 5, you also had that mental health slot as well, didn't you?
Yeah.
You're doing a lot. So I mean, everything, I suppose, over the last number of years has it psychology in some way at its core. And that's obviously a deliberate thing, obviously.
Yes, it is a deliberate thing. I mean, we're all talking about mental health more, and that can only be a good thing, obviously. I think it can be quite hard to represent. That there are some very good celebrity documentaries where somebody has a mental health issue and they use that to explore that issue, and that brings people to it. It can be hard to show, I guess. It's easier to show physical illness on the telly or radio than it is a mental health illness or difficulty, which is complex, which doesn't necessarily either have a beginning, a middle, and an end. And we know that recovery from something difficult is not linear, and sometimes recovery doesn't come. And I think for a medium that likes that narrative of we start here and we end here in a much better place, that can be quite frustrating. So I think talking about complex mental health issues, getting those stories told, can be quite difficult. And so I was really grateful, for example, like Channel 5, to deliver it to the BBC and Channel 5 are very different audiences, a different demographic. They serve different people and different audiences. And I was really pleased that we were able to do something for Channel 5 where every week we had a sort of 6 to 10 minute slot in the news, which is a busy place to get anything on, really, in the news, where we looked at something which is, let's look at how anxiety has manifested in this person and what they've done to manage it. Or, we were doing ADHD and oppositional defiance disorder. And we covered loads and loads of different topics and brought them to a new audience.
Well, the ones I saw, what I liked was it obviously had a human face to it, but also was evidence informed. And I think for me, that's so important. And obviously we're on a mental health science podcast here.
Absolutely.
And I got to keep it too often. The science is dispensed of.
Exactly. And that's really important to me, Rory, because I come from a fact background. I come from, my nearly 40 years now in journalism is about establishing the facts as we know them at that time. And it's the same in journalism as it is with science, which we can only go with what we've got now. And the more we get, the more that may shift a bit. And it's not dichotomous. And, there is nuance there, but there is fact and evidence that we can bring to an audience. That has always been absolutely critical to the work that I do, certainly. Research is crucial. In my master's, I did research into journalists' post-traumatic stress disorder and how to recover well, so post-traumatic growth, and then was able to publish that in the European Journal of Psychotraumatology, which I was really excited about. And I said to my dad, who'd worked on Fleet Street, I've got my study into the European Journal of Psychotraumatology. And his face was sort of, means nothing. But, because you only move you move the wheel on incrementally in science, don't you? I think.
And last year as well, did you publish last year the Wakefulness and Cancer paper?
So I spent 2 years working with people with cancer. I've had a cancer experience myself, and I think when I was trying to look for some places to work as a trainee counselling psychologist, I thought cancer would be a fit because I had an understanding of a cancer experience, even though, of course, you never bring any of that into the room with you, obviously, but that might make it more straightforward. Of course, it wasn't. And of course, your experience is your experience and nobody else's. It was a really good grounding in how to be a counselling psychologist. And we could use a lot of research in that as well. But one of the things that I did when I was there, and I was working at Maggie's Cancer Centre, which is fantastic, was I wanted to do a study on self-compassion and how hard it is to have self-compassion for many cancer patients. There's a lot of rumination, understandably, and a lot of negativity, but how do you develop self-compassion? So that was the study I published last year, and I've got another one coming out as well. But it's hard publishing research. You've published loads of research, and your research into suicide is absolutely top notch. And I know you've got loads out there, but it's tough. Back and forth, and that peer review process seems to go on forever. I mean, it took years to publish a paper.
Yeah, because it seems to be going on for even longer since the pandemic as well.
Yeah.
Anyway, we've been jumping around there, and so I want to just return before we get into more up-to-date stuff. Is doing the doctorate, doing the training in counselling psychology.
Mhm.
So, and that must be really challenging because you were working at the same time,
Yeah,
weren't you? You're working at the same time, and then you have to do get your number of therapy hours,
you do.
and there's a research component as well, isn't there?
Yeah, there is.
So how did that all come about, and how did you juggle that?
I have a very understanding family.
Hmm. And you've 5 children as well.
I've got 5 kids, yeah. They're not all living at home.
No, but just as a story, I think because lots of people thinking about can they juggle or can they do a career or work
Yeah.
as well as doing part-time study. So it'd be great just to hear how you manage as inspiration for others.
Do you know, I think it's really important to understand that studying is an incredibly worthwhile thing to do at whatever stage in your life. And you might not be as good as you think you're going to be at the start, and that's okay. So I remember when I was doing a master's, and I was working at the time, I think I'd left BBC Breakfast. I was on BBC Breakfast for a long time. So I presented that for 11 years. And then it moved from London to Manchester, and I couldn't go because of all these children. And so I was doing other things. I was presenting a program on Radio 4 called Saturday Live. And I was also doing a television program called Sunday Morning Live on BBC One. And so I was able to do the masters then, actually, and that was a part-time masters.
Yeah.
And I could work at weekends and in the evening, and because naturally I was getting up early because I'd spent so many years getting up at 4 o'clock in the morning. I would still get up really early, perhaps not quite so early as 4, but sort of around 5. I could get a good 2.5 hours in before the kids woke up, So I had that, I had the evening, I had weekends. So I just kept going at it. But I think the one thing that I had to learn was that while you can think yourself to be quite competent if you've worked in a particular job for a length of time, because you've been doing it for a long time and because you know the way things work and there are shortcuts and you enjoy it and you've reached a certain level. When you're a student, you have to go right back to the beginning. And that is incredibly humbling. And you fail. And I failed a lot in those early years in that master's because I was doing things I'd never done before. I didn't have a maths qualification to my name. I'd enrolled on a science master's, which had a statistics paper attached to it. So you had to do exams. I remember being in the statistics exam, and when the invigilator said you can turn your papers over now, I thought I was going to faint. I was just this overwhelming sense of panic. So there will be bits of it that are really hard to get your head around. And I remember my supervisor saying to me, I challenged him on one of his on some of his feedback and some of his marks and said, oh no, I think it's this. And he said, you may think that you're a success outside this institution. He said, I didn't, by the way. You may think you're a success outside this institution. He said, but here you are a student, and here you will fail occasionally. And that was you're going to have to be humble. You're going to have to learn how to go right back to basics. And there was a lot to learn. I was starting something afresh, but it is so invigorating.
Yeah, but then obviously those experiences were sufficiently invigorating, as you say, lead you to not only do the master's, but then translate that into a training doctorate in counselling. So had you made a decision then, okay, I'm going to think about leaving less of my broadcast or do less broadcasting to move into, because now obviously you work as a therapist now, post that training. So was there a conscious decision to make that change?
It didn't feel like a decision where I said, right, that's enough of that career and now I'm going to go over here. It felt a lot more messy, in truth. Let's use another word. It felt more organic. But it was sometimes I thought to myself, am I doing the right thing? Because I started the master's in my 40s. I started the doctorate in my 50s. I'm already heading towards 60 here, thinking that I can be a counselling psychologist. Is this a completely mad thing to be doing? Why don't you just stick with what you know? Once I completed the doctorate and had published a bit and I'd written a book and I'd been doing some private work as well, I thought, well, there's no point doing all this unless you make use of it.
Yeah.
And you've done it in order to help in some way. So start helping, start doing something with it. And I'd been in telly for such a long time, and I loved it, and I was very privileged to be in it, and it was great fun and in it for a long time. But I thought, you're going to have to do this thing now, and it might feel uncomfortable, and because there's lots you still don't know. But if you don't use it, then what's the point of this learning? So I think it was much more, it was a bit sort of muckier and messier than, I've been doing this for 37 years and I'm going to stop doing that, and now I'm going to do this. There's because it's about identity, isn't it? It's about asking of ourselves, who are we and who do we want to be? And there was, when I was doing the research in cancer and compassion, there was one of the participants who was a man who had incurable prostate cancer. And he said he'd got this line from a Mary Oliver poem. And at the end of the interview, so it was a mixed method. So I did, it was very small scale, by the way, I have to say that. So it was a pre-post mindfulness course where there were 8 people, and they went on an 8-week mindfulness course, and it tackled things like rumination and how you talk to yourself and breathing and all these different things. And I started looking at their rumination and fears of compassion, accepting it, showing it to the self, etc., and then negative experiences of cancer, and then went back afterwards and saw whether that shifted. As I say, very small. So I did the numbers, and then I did interviews with those who had shown reliable change. And so this one guy who had incurable cancer said to me that on the course he had read some Mary Oliver poetry, and the line that stood out for him was, "What is it you plan to do with your one wild and precious life?" And it always makes me feel a bit, even now I can hear my voice going a little bit. What is it you plan to do with your one wild and precious life? And he asked me that question. He was dying. He asked me that. What is it you plan to do with your one wild and precious life? And I thought, well, I could continue to do telly and read the news every day, or I could do something that has a different kind of meaning and a different kind of value, even though it'll probably be tougher, certainly won't be as well rewarded, financially at least. It felt important. So I think that's why I thought, right, this is what I'm going to do. And so I went to work at the NHS, where I've been for the past couple of years. So then how do you think your identity has changed then? And that's a really interesting question, because I raised the issue of identity, and now you've asked it back to me, and I think, has it changed, or am I just bringing my same identity to a different role? So was I equating identity with role rather than with values? I don't think my values have shifted, but my role has. So if we say that our identity is values driven, what's important to us, what's meaningful to us, what do we want out of life, what do we want to give to others, what do we want to do with our one wild and precious life, then I think the values are similar, but the role. Interesting. So we won't do this today, but I remember when I was training to be a psychologist, there was a thing called the 20 statements test. And the 20 statements test it's a social psychological thing. And you basically just ask people, who am I? And they've got up to 20 blank spaces. And that's the only instruction you give them. And then you see what they come up with, right? I'm not doing it now, but maybe something you can do yourself later, because it's a really interesting thing, because the ones higher up, the ones you come out with first, are meant to be more central to your identity. And so when I did this first in Northern Ireland, where I trained, and obviously I'm Northern Irish, Catholics and Protestants, for example, had very different identities, and like British or Irish, all that stuff. But it works the same more generally across the lifespan. You go and different ethnic groups and different occupational groups. There's lots of different ways of doing it. But anyway, so I think it's worth, Sian, when you have a few minutes. I'm writing that down. The 20 statements test. It's really interesting actually to do. 20 statements. I mean, 20. Yeah, you don't have to do 20, but it used to be the 20 statements. It used to be the 20 statements. But you know, when you say, who am I? You see, the first thing that comes to mind then, and you're right, we won't do that, but the first thing that comes to mind is, I'm a mother of fungi. Yeah. That's all. Yeah. You just sort of, you go down the roles that you play. Well, some people do, some people don't. That's what's really interesting about it. So, because some people define roles themselves by roles, and
some people define themselves by characteristics of themselves.
Yes.
I'm a kind person, I'm a compassionate person, all that sort of stuff. I'm impatient.
Yeah.
And it's just really interesting when you do it. And I used to do it with our students as well. So anyway,
no, thank you for that. But you did also make me think about the difference about how identity can either be configured by role or by the characteristics and values. And yes, I think, as I say, I think the values I probably bring to both. That's my dog, by the way, who's scratching to get out. I might just have to let her. Let it go.
I can. Oh, there she is. Yeah.
Molly the dog. Can you see her? Did you see her?
She just ran or walked past there.
Come on. Say hello.
We like dogs or cats on the podcast. So that was that sort of a nice sort of way to sort of change tack a bit, Sian. So you're now working in the NHS, and you work for CAS, which is the Centre for Anxiety, Stress and Trauma in London. Isn't that right?
Yes.
Keen to get some sense of what you're doing now in terms of that, your sort of applied psychologist role.
So CAST, the Centre for Anxiety, Stress and Trauma, is based at CNWL, so Central North West London NHS Trust. It originally came out of the help given to those who were affected by the Grenfell Tower fire in London. I wasn't in psychology at the time. I was still training, but I was there as a reporter and presenter. And so CAST came from that and the help given to families and survivors and those grieving and the community, but also first responders. And then subsequent to that, we've been working with the Metropolitan Police, the London Fire Brigade, London Ambulance, and our role is more directed towards helping people manage the anxiety, stress and trauma that comes from their work. So we do training and consultancy, a lot of trauma-informed stuff, but also one-to-one. So I do one-to-one therapy with Met police officers and people who've been affected by their job and are experiencing PTSD or severe anxiety, and helping them understand that it's not their fault. And
And so what it's in terms of therapeutic approaches, and what sort of therapeutic approaches do you espouse in that?
Well, it's a very small team at the moment. There are only 4 of us.
Okay, right.
So we come with different different modalities, I guess, or trained in different modalities. Most of us practice EMDR, which, as we know, it's a nice recommended treatment for PTSD as well as trauma-focused CBT. So there's trauma-focused CBT, EMDR, narrative exposure therapy, trained in that too. I don't tend to practice that as much because I feel EMDR works a lot for the people I work with, or seems to work with them, seems to shift things quite quickly.
Sorry, for people who don't understand, what is EMDR?
EMDR is eye movement desensitization reprocessing. So it was developed by Francine Shapiro, and it is about bilateral stimulation. So it's effectively, I mean, when I first read into it, and I did a paper on it when I was at university, when I was doing the doctorate, I thought, I can't understand how this works. Where's the evidence? Show me the evidence. Show me the evidence that this works. Because bilateral stimulation and the brain focusing on one thing while you pay attention to somebody's hand, or to beeps, or to taps, while the brain processes fractured trauma memories. It wasn't easy at first for me to fully get how it works. and in a way, I still don't, because the evidence base is not as strong as it is for other modalities, because it hasn't been around as long. But the evidence is there, and it does work. And because when we experience a trauma, as you know, memories are often not stored particularly effectively or in the right place, because you're in a survival mode. And when you're in a survival mode, your prefrontal cortex and the hippocampi and all the things that encode context and help with memory and all those bits and pieces that are quite crucial, they might not be working as effectively, because your brain is just going off like an alarm system. And so if a tiger's running towards you, all you need to know is, how do I get out of here? not where am I? Do they look friendly? What happens afterwards, etc., etc. You just need to run.
Mm-hmm.
And that means the memories aren't necessarily stored effectively. And what trauma-focused therapies help do is almost re-encode the memories and put them in the right place so they feel they're in the past. What happens with PTSD and trauma is if people are still experiencing typical trauma symptoms that they had when they first went through that experience, that they're experiencing them in the present, what they experienced in the past. And what trauma-focused therapies like EMDR attempt to do is to put those memories back in the past. Doesn't mean they won't be upsetting, because they probably will be, but they won't feel like it's happening all over again. I'm not sure I've explained that terrifically well, but
I guess a textbook explanation.
Yeah.
Well, William van der Kolk, who of course wrote The Body Keeps the Score, brilliant book.
Mm-hmm.
He wrote about EMDR, which he practices, because when he first started doing it, it was that, how does this work? But you have to tell me how it works. He said that it was 40 years after the use of penicillin that we really appreciated the mechanisms that allowed it to work, and that perhaps this is the same with EMDR. We're still there is a research base. There needs to be more, and we're in that period, but there's no doubt that it does help shift things for a lot of people.
Yeah, and of course, as a discipline, we're still a very young discipline.
Yeah, absolutely.
And we try and compare ourselves to medicine all the time, and medicine's such a longer history. But just we were chatting there about the trauma, and you just mentioned that obviously The Body Keeps the Score book, but you wrote your own book, Rise, and I've been listening to it on the audiobook recently, and it's again really powerful listen. And so again, everything just strikes me that I think that came out in 2016.
Yes, long
about
time
10
now.
years ago, I think, since you were diagnosed with cancer, I think, if my memory's correct. And so actually you were writing that book pretty, not quite contemporaneously with the cancer, but again, there's so much psychology in what you're saying, and mental health awareness and all that stuff in the book. And I know you've got the sort of diary bits plus some of the evidence and tips. Well, how did you find writing the book? Because it strikes me that must have been a really difficult thing to do. And yeah, so how was that? Why did you do it? And I know the feedback from it's been really positive, and I dare say it's helped lots and lots of people.
Thank you. Well, how did I start writing the book? I was interested in what the brain does in trauma, but not an expert.
Yeah.
And then I went through this cancer experience where I was told that I had to have a double mastectomy for breast cancer, and that had to happen quite quickly, and we didn't know the extent of the cancer. I was very lucky. My cancer was very treatable, and as you say, it's nearly 10 years, and I'm healthy and fine. A lot of my family have gone through a cancer experience and not survived, and a lot of my friends too, and I'm sure all of us listening and watching will have that same experience. So I know how lucky I am. I also recognized that I did not cope with it emotionally in a way that I thought I was going to. So physically, you're on the cancer pathway, and you're on this sort of conveyor belt where suddenly your diary is packed with appointments and scans and operations, and then more operations, and you're in the hands of a team, and you feel it doesn't feel like it's in your control, because it isn't.
Yeah.
But you've got a sort of physical recovery to manage. That was okay to a certain extent, but when it came to the emotional recovery, I was struggling quite badly, because I'd never been one to ask for help, didn't know how to ask for help, didn't want help. It wasn't that there were plenty of people who were offering it to me, like my husband, but I didn't want him to come to any appointments. I just shut everybody out and thought I can manage this on my own. I was writing a diary. I've always found writing very therapeutic, and I wasn't intending for any of that to be published. And I was writing another book on trauma, which didn't have my experience in, but focused on people who'd gone through very different experiences and wanted to know whether there were any commonalities in their experience and how they recovered well from that experience. So I wasn't in there at all. And then I had the cancer experience, and I was writing a lot, not ever intending for it to be seen by anyone. And my publisher said, I think that needs to be in there because it just feels more honest. And I thought, no, nobody's going to want to read that. And it's raw. Some of it is, and you'll know if you've listened to it, some of it feels to me now quite raw and ugly.
It sounds it. And also because you're reading it yourself as well.
Yeah,
it is really powerful.
Yeah, but I think in order to show what going through a difficult experience can honestly be like, I mean, from a very personal, individual perspective, and everybody's experience is different, I recognize that. But when I reflected on it, I thought, yes, maybe it is important to show the fear, the real visceral fear and doubt and questions and sometimes the sort of the farcical nature of it and what it's like to be off your head on morphine. And, you know, if you're on the other side of that experience, looking back, it feels very different. If I'm now to reflect back on that cancer experience, I would frame it very differently because 10 years have passed. So I can say, oh, yes, and I did this and I did that. And then I ran a marathon and hurrah. It wasn't like that at the time. It was, if I see somebody who's gone through a cancer experience and they're telling me how well they're doing one more time, I'm going to go mad. So I felt it was honest, kind of painfully honest, but that felt important actually in the narrative. So you heard not just how sort of people have recovered and recovered well and how they've done it, but also what it's like to be in that place where you think, I don't know how to get out. I do not know how to get out of this emotional hole that I'm in. And so, and I think another reason for doing it was that I wanted to research the heck out of it. So because I needed to know. So in a way, it was quite, the intention might have been quite a selfish endeavor, as well as wanting to find out how other people recovered. Part of it was, I want to know how to recover. So where's the research that tells me how to recover well? What do I need to do? Because I'll do it. I just need to be shown it because I've got to get from where I am now to somewhere else. So
but that's what it does. It does both of those things. You get the humanity of it plus tips and guidance to help others. I think that's what's really great about it. It's that the practical components as well as a human story. I think that's all the best books are. Yeah.
Well, I guess as well, I was lucky in that I was doing a couple of Radio 4 programs at the time. I did a program called The Science of Resilience, and that helped introduce me to some concepts and some people where I thought, okay, well, that's great for the program, but I want to know more about that. I want to know more about brain-derived neurotrophic factor, BDNF, and how exercise can strengthen neural pathways. And this is after I'd done I'm just trying to remember where we are now in that. This was after I'd done the master's, but before I'd done the doctorate. So it still felt to me like there was a lot to learn. And I could go to all these different experts and find out, best way of sleeping, best way of eating, best way of exercising. What can we do? What small steps can we take? And understanding as well that thing about recovery not being a linear thing, but back and forth and up and down, and forgiving yourself, because I think you need to give yourself permission to recover slowly.
Well, that's self-compassion again, isn't it?
And compassion, absolutely, absolutely, self-compassion, yeah.
Okay, so well, thanks for writing it, and obviously great that.
Thank you. Well, thanks for reading.
It's all great, and you're healthy, so fantastic. Okay, we're sort of coming towards the end, but the last thing just on the trauma bit is, because you're not only are you doing the treatment work, but you're doing quite a bit of advocacy work. I know obviously with Prince William, you've done some work over a number of years, I think, with the Royal Foundation on trauma in the context of healthcare settings. Isn't that right?
In the context of first responders and the emergency services. So yes, I was asked by the Royal Foundation, actually years ago, I was asked by the Royal Foundation to run the marathon that I mentioned. And I was recovering at the time, and I thought, I can't do this, but it was for Heads Together, which was for mental health. Anyway, I did run it. But I think I was impressed by William and Kate's attitude towards mental health. And I mean, Kate was very involved even then, although she wasn't talking about it publicly as much, in the mental health of young people. William's interest, obviously, because he has been involved in search and rescue, his passion is in helping people who go out to help. How do we best look after them? And he's very well read on it and really passionate about it. Anyway, I was asked to go to Milton Keynes, which has a hub for fire, ambulance and police service workers. And we got a group of people together, and William came along and spoke to them again, really openly and honestly, about asking them about the challenges they face with their mental health, asking what would best support them going forward, what kind of help are they getting now, etc., etc. I find that has opened up lots of different conversations away from that subsequently as well. So for the past couple of years, the Royal Foundation has backed the Emergency Services Mental Health Symposium, which brings together all these different groups and first responders and looks at the research that's available, what's it telling us, where's the support, who's funding it. It hears lived experience. The last one we did, which was in November of last year, there was a firefighters charity, which is a brilliant charity, which launched their helpline. There was a national helpline established. Also, a way of there was a network that was setting up, bringing together all the counsellors and therapists who'd worked with emergency responders, because emergency responders are a bit like, they share characteristics with journalists, which I understand, which is there is danger there, I'm going to run towards it, and journalists run towards it to witness it and show it to the world, and emergency responders run towards it and help. Yeah. And they don't just do it once, they do it again and again and again and again. And they will see more traumatic events and be immersed in more traumatic events in their lifetime, in a couple of months, than many people will see in a lifetime. Yeah. And how do they manage that? And it's not a well-rewarded profession. So how do we keep them in it? And I was with firefighters last week doing workshops, and we were talking about that. How best do we understand how this culture works, where you still want to do the job and you want to support yourself and your colleagues to do it well. And you're also aware of the sort of incremental drip, drip, drip of cumulative trauma. So how do you cope with that? And I just think it's a really important place to be.
Yeah, and it's great to see that the Royal Foundation, alongside people like you, supporting that work, really important work. And I had the pleasure of meeting William and Kate, I think it was last year when they came to Glasgow, and I was super impressed by their commitment to mental health.
Yes,
across the spectrum. And
absolutely.
And even Kate and William were talking about their loss when they lost the baby, their miscarriage, and as well. So it was just really open conversation, as well as really interested in suicide prevention as well. So
yes, yeah, and I do think, if you have William sitting in a group of people saying, it's tough going out there and seeing what we see, and then back out and doing it. It doesn't matter what your job is now. If you've had that experience and you're able to share it with others who are doing it on a regular basis, it opens things up, and people are much more able to talk about it. And I think that shifts the culture. It really does, because I think there's also this, well, it's our job, it's what we're paid to do, we just got to get on with it. And I recognize that from my days as a journalist. It's your job, just get up and get back in there. And, well, okay, I really want to, but how am I going to do that and look after myself so that I can do it well? And I think that's what's important. There's still big challenges, Rory, as you know yourself. We have a police officer in England and Wales dies by suicide just over every 2 weeks. We know that incidents of mental illness are higher in the emergency services and in journalists and in those kind of professions. They are higher. So if we're going to keep people going into the professions, how do we catch people upstream? So we're not trying to put people back together when they've already got PTSD or anxiety or stress or severe trauma symptoms, but how do we help them recognize? How do we have a more trauma-informed approach right at the beginning of their career, where we say, okay, these are things to be looking out for. How do you best protect your mental health now? How might you do that when you're faced with this? Who will you talk to? Before you go out to a difficult event, during and after, so that we have those conversations and we catch people upstream, so that we're not reacting to incidents of anxiety, stress and trauma too far down the line where we've got illness and people having to take time off work. It's preventative work. It's crucial.
Yeah, prevention is without doubt much better than cure in that context.
Absolutely.
Actually, that reminds me of a study that MQ funded by Professor Jennifer Wild that was looking at PTSD in healthcare workers. It's called Shape Recovery, and it was meant to only be about paramedics, but during the, I guess, pandemic, it got much bigger and was looking at frontline healthcare workers on a whole. And it was an evidence-based intervention that's looking at trying to help people before they actually have a full-blown diagnosis of PTSD or depression. So yeah, I do agree that that's an area that we should really focus a lot of research and a lot of funding on.
Okay, Sian, two last things. I'm going to ask you,
Okay.
if we were able to give you all the money in the world,
what
do you think is the sort of what we should be investing in that in? What do you think are one or two you think key priorities? What don't we know we need to know in any aspect of mental health? It's up to you.
Gosh, that's a huge field, isn't it? I could choose loads, but I will just choose, as a mother of 5, so I've got children ranging from the age of 15 to 32. So I've been mothering teenagers for 3 decades. I think, and I've seen how the challenges to teens' mental health, adolescents' mental health, have increased over the years, because I've had teenagers in that 30-year period, across that 30-year period. I think what we need to look at is how we protect adolescents' mental health, because they are going through this extraordinary change in their brain with increased myelination and brain development that happens during adolescence. They're a lot more likely to take risks. We know that their prefrontal cortex, all that stuff isn't quite developed enough to an adult stage. And it's a difficult and complex world out there, and a lot more uncertain than it was in terms of what jobs they end up doing, the social media pressures, et cetera, et cetera. So I guess I would like more research to go into how best to look after our young people.
Yeah. That's a great suggestion. I think there's no doubt in this world that, irrespective of which statistics you look at, that young people's mental health, even before the pandemic, has been just getting worse and worse, sadly. And we just don't know the right answer. There's no one simple answer for why that's the case. But I agree, that's a great ask to try and understand that and hopefully then mitigate the risk. Okay, that's the suggestion. Right, so just to bring it to a close, we try and sort of end with a couple of unrelated questions, because it's quite heavy material we've been covering there. Covered a lot of ground, and obviously 40 plus years of your life in a short period of time. But so 2 questions is, and that's quite nice the way you've been reflecting there on the 3 decades of parenting teenagers. But maybe if we can reflect back to when you were a teenager, what advice would you give your 16-year-old self?
I was an anxious child, and the advice I would give is your sensitivity can be a strength. Try not to be consumed by anxiety and let it stop you doing things. Try to recognize that level of sensitivity might help you in your career, because if you're sensing how people are feeling, and it can be, anxiety isn't always a terrible thing. That I would have wanted to have told myself about that brilliant Diane Fossey study, where she followed a tribe of chimps, and there was a small number of chimps that were anxious and depressed on the outside, the outskirts of the troop, and a bit socially disengaged. And when those chimps were removed, the entire community suffered because the anxious chimps were pivotal for survival. I would go back and say, try not to be consumed by worry. See when it's productive worry. Is it something you can do something about? Then do it. If it's not useful to you, then let it go. I suppose
related to that, I think that's a great suggestion. I suppose it's also helping why am I answering your question? But the bit of it's helping the 16-year-old self recognize that your sensitivity to threats in the environment is so hyper you're so hyper vigilant at that stage as well. And it's realizing actually, as you leave adolescence, and that I often talk about it as a sort of psychological thin skinness.
Yes.
Often that your skin gets a bit harder, so to speak. And yes, I think it's a great suggestion about, it serves a function, and it's maybe trying to understand that function in context.
Exactly.
And it might help you later in life. Yeah, great suggestion. One very, very last, time for one last quick question then. So if you could have dinner or a coffee with anybody, living or dying, famous or not famous, who would that be and why? I know it's a bit unfair just throwing that question at you, but you've over 30, I think you said 37 years of experience in broadcasting.
Suck it up. Okay. I would like to have dinner with my grandfather, who was an extraordinary man, a preacher and a poet. And he was a Presbyterian minister and a published poet. I didn't really know him, and he died when I was about 12. And I've recently discovered little poems and things that he wrote to me in a notebook. And I was doing a St. David's Day speech the other day at the Guildhall, and I found one of his sermons. I'm not religious myself, but I found one of his sermons, and it was about being grateful for the little things in life, even during the worst tumult. They'd just come out of the Blitz when he wrote the sermon, the Swansea Blitz in World War II. And he wrote this thing which picked up on St. David's phrase about doing the little things, look at the little things. And I thought, this is an extraordinarily wise man who is part of me and part of my history, who I feel I can really learn from, and I don't know enough about. So I'd want to know more about him.
Yeah, that's a really poignant one, actually. Yeah, that's lovely.
Is that too depressing?
No, that's a lovely. No, it's a really nice one.
That's really beautiful.
My
really
dead grandfather. Is do you want to choose another one? No, so it's my Tide. He taught me to play the piano, which I've now forgotten, and he wrote me some poems. And he was clearly a really good man, and I'd like to understand what led him to do what he did. Yeah.
Well, on that note, Sian, thanks so much. You've when you mentioned understanding there, you've done a lot to help us understand what your journey has been, and also crucially, I think that important role of, or not role, but the parallels between the sort of journalism role, the psychologist role, and then obviously when we think then about the first responders, and there's so many parallels. But what I've really loved about your story is, but they've all that psychological thread has run through them all from it seems a very early age. So thanks so much for sharing them with us, and the very best for whatever 100 million things you do next.
Oh, thank you. It's been an absolute pleasure talking with you and meeting you again after your inspiring lecture and all the work that you do, all the important research that you do. So thank you. Thanks for asking me to be a part of this.
Thanks so much, Sian. Thank you.
Thanks.